Well, good afternoon. It's great to be in West Palm Beach. People from all over the country are looking at Palm Beach County. I know the real estate is going up because it's such a great place to live. We're happy to be here at Okeechobee Steakhouse to really send a message that at a time when folks in our service industries, particularly restaurants, lodging, and hospitality, have kind of taken it on the chin, particularly in some other states where they've been completely shut down. We just want to send the message, you know, some may want to shut you down. We want to pull you up. We've got your back. If you're somebody who's a waitress or a cook or you're a family-owned business, you're an important part of our state. You're working folks who are working hard to make a living. You have every right to do that, and you can take it to the bank in the state of Florida. You're going to have that right defended by the governor. You know, there's a lot of talk when it comes to COVID about kind of infections and tracing and everything. And at the beginning of this, restaurants in particular were singled out as kind of like, this is a place that's really problematic. Most of the contact tracing that's been done has restaurants as very low in terms of where these infections can be traced to. New York just did their big one and put it out, I think, yesterday or the day before, and they had 1.4% of infections traced to restaurants and bars. So it doesn't mean you can't happen here, but I think we have to understand the vast majority of infections are occurring in people's homes, particularly if you have people getting together. So closing a restaurant for indoor dining is going to lead to more people doing that in private homes anyways. But here's the thing. Even if you think that it's more than just 1.4%, the appropriate response to that is to inform people about situations where you may have you know, a higher risk, not to shut down. Let individuals make decisions about what they're comfortable doing. I can tell you, we've worked with these folks across Florida, and I know Okeechobee's no different. They put every effort to creating a safe environment and a healthy environment. They're not going to get customers unless they do that, and I know that that's what they've done here at Okeechobee Steakhouse. And so we're coming up on Christmas. It's an important time of year for a lot of people, and we just want to let people know, you know, if you're somebody who's working hard, you know, you're a worker in one of these industries, we're standing with you 100%. We know what you've done. We know you've sacrificed, but we also know how much these jobs mean to you. And how much these industries mean to the state of Florida. And we have a bunch of great folks who are just going to offer a few things. And so we'll, I'll call them up one at a time, but we'll start with Ralph Lewis, who's owner of what I'm told is the oldest steakhouse in the state of Florida.
Yes. Good afternoon. My name's Ralph Lewis. I'm a third-generation co-owner of the Okeechobee Steakhouse here in West Palm Beach, Florida, and yes, we are the oldest steakhouse in Florida. Been here 73 years. I was the first person in 73 years that ever had to lay anyone off. So bringing people back was crucial. When you have single mothers with tears in their eyes because they don't know where their next paycheck's coming from, that's a big burden, and it's a concern, and we care about our employees and staff. Also, their health insurance. At a time like this, excuse me, you know that health insurance is extremely important. So keeping them with health insurance, keeping them where they can pay daycare. We also were able, because we were able to open back up to full capacity, we fed 6,000 first responders for absolutely free. We fed hundreds and hundreds of children, underprivileged children at Boys and Girls Clubs who didn't have food, didn't have meals, because we were able to be open. We've spent tens of thousands of dollars here to make the place safe. Our guests believe it is safe. We are running fairly busy, about 70–75%, which is great. We'll take it. Things are getting better. So I would like to say, by Governor DeSantis keeping us open, moving us in this direction, it's been a game changer, not just for us, but 107 families that depend on it directly from us. And because of this, we are planning on opening another restaurant soon. So I'll turn it back over to whoever wants to speak next. Thank you.
We'll do Siobhan Wilson, one of the servers here. There you are.
Hi, my name is Siobhan Wilson. I've been here for 23 years. I was actually able to buy a house over the summer in the middle of this pandemic, only for the fact that Ralph and Curtis kept the restaurant going by putting a barbecue truck outside, which I worked at. Thank goodness, even though it was hot, well, we made it. But if I hadn't have been able to do that and stay open right now, I'd still be renting. And it was my first home, and my husband and I are very fortunate that Governor DeSantis has decided to keep our state open. Thank you.
Thank you. All right, we also have Teresa Hogden, who's a server and a bartender at Okeechobee Steakhouse.
Hello, I'm Teresa Hodgson. I've been here for 14 years. Ooh. Single mom of 2 kids. No other income coming, so sorry about this. Very blessed to have Governor DeSantis keeping us open. Very blessed to be able to work with Curtis and Ralph and how they pushed everything, so I would have lost everything. So I'm a blessed mother, and I just hope that we can still stay open and, everybody do what they're supposed to do. And if you're sick, stay home. If you want to come out, we are here for you, and we are 100% committed. Thank you.
All right, we have one of the cooks. I heard you guys have great steaks. Jason Ramey. Jason?
Hi, I'm Jason Ramey. Been here for about 3 years, and thanks to Governor DeSantis and the Lewis family, I was able to support and raise my daughter and my wife and pay my mortgage on my house. So thank you, thank you, thank you.
What's the best dish here?
Bone-in ribeye. It's rare.
All right, and then also we have Chrissy Fabra. What is that? I'm sorry, Wishart. Yeah, General Manager here at Okeechobee.
Good afternoon. I'm Christina Wishart. I'm the General Manager at Okeechobee Steakhouse. I've worked here for 26 years. It's really important for us to stay open. I mean, right out of high school, I started working here as a hostess, and I pretty much made the restaurant industry a career. So this is all that I know. If restaurants weren't able to stay open, I probably would have to find a different outlook and work. So I'm very fortunate for you. Thank you for allowing us to stay open and for us to just thrive and do what we know. Coming out to the restaurants is a choice that everybody makes, and if you choose to come to Okeechobee Steakhouse, I will guarantee that this is the safest, most comfortable place to eat. Thank you.
Thank you. All right. Okay, we got Michael Klein, Kavasutra. Tell them where Kavasutra is since we're not here.
Good evening. I am Mike Klein with Kavasutra. We have 15 locations, 10 of which are in Florida. We have 2 locations in New York City and 2 locations in Colorado and 1 in Phoenix. So we have a good amount of knowledge about how different states are functioning right now with different lockdowns. And when the lockdowns first happened, we didn't really know what was going to happen. But our biggest concern was always our staff and our employees, making sure that they could pay their bills, take care of their families. And thanks to Ron DeSantis, we are able to be open 100%. We are able to expand, grow new locations, and we're able to survive. So thank you.
Thank you. All right, and then we have Jose Olascoaga. Did I pronounce that right?
Pretty close.
Bartender from Kavasutra.
Pretty close.
Hi, how you doing, guys? I'm Jose. I am one of the district managers of Kavasutra. I manage 3 of their locations. And I just truly want to thank DeSantis for, actually caring for us and putting themselves in our shoes and understanding that, we need to work. And without, him allowing us to be open, I don't know how we'd be able to pay our bills. I just got a new home. I can pay my mortgage. I can take care of my family. And, it all comes down to COVID isn't going anywhere, and we're going to have to learn how to live with it. We're going to have to learn how to adapt, and we have to thrive and keep moving forward. Thank you, DeSantis.
Good job. Thank you. Okay. This is the main guy, man, the butcher. Bernard Exantis, Okeechobee Steakhouse.
Good afternoon. My name is Bernard Exendus. I'm a meat carter for Okeechobee Steakhouse, and I've been working here for 20 years, and I'm proud to be part of the staff of Okeechobee Steakhouse. I must say thanks to Governor DeSantis for allowing the state open, especially for the business to stay open. If the state was like shut down, we won't be able to pay our bills. And my family, I got a family, I got a new home. I just bought a new home. If the steakhouse was like closed, I won't be able to pay my bills. So I must say thanks to Governor DeSantis for letting us, open.
What's the best cut of meat here?
Born and way back, like Jason said. That's the best one. Thank you very much.
Thank you. All right. Then we have Brian Alexander Chamis. He's from Cafe Chardonnay down the road.
Hello, my name is Brian Shamus. I work at a restaurant called Cafe Chardonnay. We've been there for 34 years. This has been the most difficult year for us. I'm in the restaurant business. My wife is also in the restaurant business. So 100% of the money that we make comes from this business. So if it were to be shut down, it would be very difficult for us. Thank you, Governor DeSantis, for allowing us to stay open. I think if you work in a COVID-friendly or a COVID knowledgeable environment, and you allow your guests to feel comfortable and safe, I think it's great to be open. I think it's great to have the opportunity to be open. So thank you very much for that. Enjoyed it. Thanks.
Thank you. Jackie McNett.
Hi, my name is Jackie McNett, and I work at Park Avenue Barbecue in North Palm Beach. And I was a server when we closed down for COVID. We were takeout only, and I'm thankful that you allowed us to do that. And I got to keep my job, and I hope that restaurants do continue to stay open, because it's not just servers and the takeout people that are affected, it's the food runners, the bussers, the dishwashers that no one sees behind the scenes. Thank you.
Thank you. Well, thanks for Okeechobee Steakhouse for hosting us. I just really think the folks in this industry work very hard, and I think that they've had to go through a lot of uncertainty. We've obviously really put a priority on making sure that they had the right to put food on the table for their families, but also just understanding that the evidence at this point does not show that restaurants are a significant draw. It doesn't mean it can't happen. Obviously, when you're contact tracing and you find some, that's fine, but that could happen just as much in a home or anywhere else. And I think it's unfair that if a politician wants to do something, then they immediately look at the restaurants, and they're really hurting these people without a solid evidence basis at this point to do it. Again, in March, we didn't have a lot of evidence, but now we do. And these folks really care about the safety of their customers, and I know they work very hard to create a safe environment. And I think that we finally have some momentum as a country with these vaccines coming in. It was a really historic occasion for me. I was at Tampa General Hospital yesterday. I actually signed the FedEx form for the first vaccines delivered in the state of Florida, and we got about 180,000 from Pfizer, both on Monday and then today. On Monday, we had Tampa General, Broward Memorial, and UF Shands. And then today, Jackson Memorial in Miami, as well as Advent Health in Orlando, received shipments. So they're all getting about 19,500 doses. They have to store at -70, and they're doing that, but they do a great job with that. They are using the hospitals are using theirs to immunize their frontline high-contact healthcare workers who are most likely to come in contact with someone with COVID, and then therefore most likely to end up being isolated if you end up having an outbreak, which there haven't been a lot, but if you do. So that was kind of the theory behind it. Make sure the folks that are caring for patients are going to be in good shape. You're not going to have dozens of people have to isolate because of an exposure. All 5 of those hospitals are helping with other hospitals in the area. We were limited to 5 hospitals because they didn't want to have it go to 200 hospitals and then have any mistake exacerbated. They wanted to pick 5. It was kind of a beta test. Can we get everything on target the first time, and then you open it up? And so that's what we're doing. We picked those 5 because we thought they were representative of big populations, but Jackson is working with all the hospitals in Miami. Broward Memorial, I know, is working with hospitals throughout this area. So you're going to start to see hospitals beyond those 5 have their workers get these shots this week without a problem. And then tomorrow, we have in the state of Florida, we'll be making an announcement about what we're doing to help residents of nursing homes. Very, very significant that we provide vaccinations to anyone in a nursing home who wants it. Obviously, they are the most at risk from most infections, but certainly for this one as well. And so it's important to be able to help them ward off that so you can help. But even the ones who get it and recover, and many of them do, and many of them never get it, this has such a huge impact because of all the mitigation that goes on. They haven't really been able to have, I think, a full ability to thrive over these many months. Now, we make sure they can have visitors, and we've supported all that, but it's just not going to be the same until we get the vaccinations in those facilities. And so we're going to start that process tomorrow. We've got thousands of facilities in Florida. It's not as easy as it would be in some smaller state. You're talking about between staff and residents. I mean, these are hundreds of thousands of vaccinations that need to take place, but it is a priority. We then will, and then Thursday, we anticipate a recommendation for the Moderna vaccine, and I think you'll get an EUA issued by Friday night. I spoke with the FDA commissioner this weekend. That was basically what they did for Pfizer, so I think the timetable will be similar. What will happen then is the orders will ship probably Saturday, Sunday. Florida, we're getting about 370,000 doses of the Moderna for what we're calling week 2. This is week 1 with the Pfizer. So that is then going to go to a broader range of hospitals. Obviously, going to continue with the hospital mission, but we do, as soon as we get more and more vaccines beyond what the frontline healthcare workers need and beyond the nursing homes, we really want to get it out to the broader senior community here in the state of Florida, because we believe if we can do a big chunk of that, and we're not forcing anyone to take it. I think most will want to, but we're not going to force. If you can do that over these next 6 to 8 weeks, that's going to have a huge, huge impact on the course of this thing. And so that's going to be a big, big priority. The one thing that we're looking to see is what additional Pfizer are we going to get this month. When we had the initial rundown, when I met with Warp Speed about a month ago, we were supposed to get for week 2, which is next week, 205,000 Pfizer, and then the next week, 247,000. Those next 2 week shipments of Pfizer are on hold right now. We don't know whether we're going to get any or not, and we're just going to have to wait. I mean, obviously, it would be shipped relatively soon if we got it. It's a production issue with Pfizer. It has nothing to do with the federal government or nothing to do specifically with Florida. This is just what's happening nationwide. And then after we get the 370,000 roughly Moderna for this coming next week, the final week of December, we're slated to get another 162,000 doses of Moderna. So that'll be 530 doses of Moderna for December. And as of right now, we obviously have received about 180,000 of Pfizer. If we do get the next 2 weeks, which is still unclear, that would bring us to 631,000 of the Pfizer. So that's over 1 million doses if we get all that. Obviously, if the Pfizer doesn't come through in the next 2 weeks, then we're looking at probably roughly 700,000, a little more than 700,000. Look, either way, we're going to make good use of it, but we really believe that our healthcare system's ready to do this, and that if we can get the 1.16 million doses in December, it will offer all nursing home residents, nursing home staff, key frontline healthcare workers, and then start to be able to offer it to the broader high-risk community seniors. Now, obviously, as you get older, you see the statistics. I mean, it's just much more dangerous. But there is a big difference between if you're in a long-term care facility and if you're out in the general public. I mean, fortunately, those folks in the general public tend to deal with it better. Nevertheless, we really view that as a priority, and so we want to do it. So, and then these monoclonal antibody treatments, we're getting about 6,000 a week in the state of Florida sent to various hospitals between the Regeneron and the Eli Lilly monoclonal. And it's going to take some time to get hard data. So a lot of this is more anecdotal, but I can tell you everything we've ever sent, first hydroxychloroquine, then convalescent plasma, then remdesivir and all this, this is by far on an anecdotal basis been the best treatment that we've seen for this. I mean, obviously the president made it famous when he did the Regeneron, but talking to doctors about the Lilly, when they're finding high-risk patients early on in the infection and they give it to them, it's having a tremendously positive effect. So we hope to see that scaled up, the production, because they're doing 300,000 a month for each company. If we could double or triple that, that will be really, really good, I think, for the country. And obviously, Florida, we would stand to benefit from that. So the treatments have really improved, and I think that that's something that's really, really positive. So yesterday was really exciting because this was a huge undertaking in terms of logistics that the federal government had to do, and they did it in conjunction with FedEx. And FedEx, that they do this all the time. I mean, this is a very sensitive product, but you should see how crazy people get when they do the iPhones. They were telling me that anytime a new iPhone, it's like a huge deal. So they kind of are tried and true. Everything went very well yesterday around the country, and we anticipate hopefully that continues. We assume that there would be hiccups, and there haven't been yet. But at the end of the day, I mean, this is a great opportunity for a lot of folks. So we're really excited about this. We feel that this can really help turn the corner. And, you know, look, in Florida, these folks have the right to work. There was a lot of people several months ago that said that was such a bad idea. But here's the fact is, you know, right now, there's probably 40 states that have higher per capita cases and COVID hospitalizations per capita than the state of Florida does. And so some of these shutting people down, not letting them work, restricted, it just hasn't worked very well. And so I think we need to look at the data and the evidence and say most of the spreads at home, most of the seriously at risk are nursing homes, and let's really focus the efforts in terms of mitigation on protecting vulnerable people. That's what we've tried to do here, and I think that that's a better approach because it allows folks like this to be able to have their livelihoods intact, and it allows us to really focus, I think, on where some of the more significant risks actually are occurring. So thank you. Happy to take a couple questions. Yes, sir. So a couple things. One, most major hospitals will get the Moderna, so that's going to happen within a week, and that'll be great. I'm pretty sure Broward Memorial has worked with some of the Palm Beach County hospitals in the meantime to be able to give them the Pfizer. So we anticipate that'll happen soon. So the question is widely available. I mean, I think realistically we're looking at best case scenario nationwide is 20 million vaccinations this month between Pfizer and Moderna, and 30 million nationwide next month between Pfizer and Moderna. And if we don't get all the Pfizer this month, maybe it spills over. So 50 million people probably in the next 2 months we're looking at. Of course, in Florida, we're 6.5% of the country's population. So if you did it on a pro rata, you know, you could do the math. That'd be a good chunk for us now, but that's not even close to the whole population. But I believe if you can get a big chunk of this at risk, the senior population, and you do the nursing homes, the mortality on this thing is going to crater. And so that's a really good first step. In terms of getting it widely available, I think the trick is going to need to be the EUA for the Johnson & Johnson vaccine. So the Johnson & Johnson vaccine, unlike the Pfizer and the Moderna, it's only one dose. So Pfizer, we're bringing it in. They have to have these massive gloves to store it in -70. Moderna is freeze, not quite that cold. But the Johnson & Johnson is just normal refrigeration, and you take it one time. That makes it easier to do on a mass scale because you can go and a school district can offer it to the teachers, one shot, and you don't have to worry about going back. See, with the nursing homes, CVS, Walgreens, and the extent the state's involved, we're going to have to go back in 21 days and make sure they get the booster shot. Now, both Moderna and Pfizer, people think that first shot offers some protection, but obviously you're going to need to get that to have staying power. So the Johnson & Johnson, we think they're going to file for EUA sometime in probably the later part of January. And if you look at the same timetable, maybe give it a week for approval, that can be produced at scale and pretty quickly. So my hope is that if J&J is approved, you start to see this become, more widely available. The first month and a half, 2 months here, I mean, we really are going to focus on nursing homes, those tip-of-the-spear healthcare workers, and our senior citizens. There's probably not going to be much of an option for someone who's like 35 and maybe working at an elementary school. But I think as J&J comes online, then those possibilities are going to be there. And look, we're not mandating this. We're going to provide it for folks who want it. And I think we've seen, more and more people, have decided that they want it just over the last few weeks. If you look at kind of how the signals are going, and I know in the hospitals, initially they had some takers, and those takers are more because people have seen it done. And one of the things, we were kind of upset that Britain had it before us. But then on the other hand, I'm thinking, well, you know what? They've been given shots for a week or two, and the sky hasn't fallen. So that's actually a good thing. People can see that, and then they have confidence that, okay, maybe this thing isn't going to be any problem. So, but I think we're looking at with John. I think to me the key is the Johnson & Johnson to get it more widely available.
See everybody behind you wearing masks. Scientists we talked to in our community say it would be helpful if the leader of our state insisted, with all the help coming our way with vaccines, on a mask mandate. Even if everybody didn't follow it, scientists have argued to us again and again.
Okay, but it doesn't matter what they argue. What are the facts? So first of all, I don't believe in mandates.
They say the facts are that mask wearing does help. And that
that's not the same thing as a mandate, though. Whether you wear it or not is not the same as a mandate.
But why not mandate it?
Because of the states that are ahead of us, 40 states that have higher caseloads, 40 states that have higher per capita hospitalizations. We're in the bottom 10 states for per capita cases, and this is with being open for months and months. So the question is, why are cases exploding in California? Why are hospitalizations exploding in other parts of the country, particularly states that have said that they've done all these great restrictions and mandates? The mandates, I don't think, have been effective. I don't think the restrictions or the lockdowns have been effective. And so people wear them in Florida. Everywhere I go in public, people do it. They don't need to be fined for it. Okay, we need to treat people with respect and trust them to use judgments. But imposing mandates, you can't look at the evidence right now and say, because if the mandate was so important, Florida would be higher than all those states. And yet we're lower. We're lower than New York, New Jersey, Connecticut, Pennsylvania, Michigan, Illinois on a per capita basis, now California, because they're finally kind of going through a big thing. And so that's just the facts on it. And I think that people should look at that. We have in Florida now, I mean, we'll see what happens with the emergency department visits, but we've been going down since 11:30. And we'll see, because these things go up and down. But I would note, a lot of these experts were saying that the United States, because of Thanksgiving, was going to have this massive surge. There's going to be all this problem because people had the gall to go see their family. Well, look at the national indicators since Thanksgiving. It's actually gone down. Midwest is going down. California is going up, but many places, are not surging. Some may go up in a seasonal way, but you don't have the massive. We had some of these experts saying in mid-November that the hospitals would be overrun and collapse across the country in 2 weeks. Well, we're now a month past that, and you haven't seen even close to anything collapsing. So, let's focus on what's actually happened. And the fact is, we always hear these things put out about hospitals are going to collapse. This is going to happen, Thanksgiving. And yet no one really goes and checks to see whether, did that actually happen? And the people that make the predictions and they're wrong, then they go right back to them and they get to make more predictions. The vaccine, obviously, all these people said it was impossible, and that ended up being the case. So, so I just think use common sense. But let's keep people employed. Let's keep kids in school. That's a huge thing. And it's interesting. In the summer, when we were pushing for that, a lot of parents were happy, but you had a lot of these people saying it wasn't safe, and that the data didn't support it. Data supported kids being in school. We've had it, and are there any parents that would not stand for schools being closed, because it's not consistent with the actual data and the science, even though you did have some experts at the time trying to act like it wasn't safe because they didn't look at the situation in Europe and all these countries that had done it and done it effectively.
Governor, what would you say to the local leaders
some of whom have said that their response to the virus has been restricted or hobbled because of your executive order.
Well, if a local leader wants to put them out of work, you're damn right I'm hobbling them from doing that. If they want to shut down businesses, I'm going to stand in the way. I'm going to stand with these folks here because they have a right to make a living, and I don't think government has a right to put these people out of work and to not let them put food on their family, on the table for their family. That's a basic thing that I think everyone in the state of Florida should have to do. They're doing it, working hard. They're doing it with safety in mind. And I have not seen a single business owner, I have not seen a single employee who has acted like this virus isn't real. They all understand that, but they all also understand that they have to be able to make ends meet. And so the question is, you want to do it and let people operate in a safe way, but we are not going to let them put people out of work, and we will absolutely stand up for working people throughout the state of Florida. Yes, ma'am. Oh, yes, sir.
The general public won't receive the vaccine until perhaps April of 2021, according to our health department. What is your administration doing to alleviate and make sure that the public feels safe about taking the vaccine? Because a lot of people are somewhat afraid to take it.
Well, a couple things. One, I'm not sure that April is right because I think when you look at Johnson & Johnson, I think if that does get EUA approval, I think you're going to start to see this be widely available relatively shortly after that, which I think will be a really good thing. I mean, they're really producing that thing at scale for that. But here's what I say on the vaccine. I mean, look, this thing was politicized during the campaign. Let's just understand, these are really, really strong companies that have put a lot of resources in. Obviously, the federal government has put a lot of money into it. It's gone through the same process that anything would normally do. People say it takes 2 years to do a vaccine or 3 years, and that's traditionally been true. But it's not because it has to take that long. It's because the machinery of the bureaucracy usually works so slow. And on this situation, they said, you guys got to kick it in gear. So they went through everything that they would normally do, and then did the trials, got the results. People were able to evaluate it, and we've now had a lot of people that have gone through the trials. We now have shots have been happening for a couple weeks in different parts of the world, obviously this week for the United States. So I think it's something that people should have confidence in. At the same time, I think it's perfectly reasonable for someone who may not be terribly at risk to say, okay, well, even if it was available to me, maybe I'll wait. I understand why someone would want to do it. If you're higher risk, I think you probably want to get it as soon as possible. But I'm confident that as more and more people get this, people are going to see, you know what, that's something that would make sense to me, and we're going to do it. And I think I would definitely want it widely available with J&J before April. And if we're able to do that, I think we'll be in really, really good shape. And we've got a lot of opportunities, I think, here in the state of Florida. The people that have left some of these other states, they're coming to Florida partially because I think that they appreciate, a more balanced approach on some of this stuff, but also what we've been able to do in so many other areas of the economy and all this. So we've had some bumps with what's happened in some of these industries, but I think we're primed to do very well in the future, and getting the vaccine out, I think will be a part of that. So I would definitely have folks trust it, but I think it's important that the fact that we're not mandating it is, I think, probably better, and I think you'll probably get more compliance because people aren't going to feel like this is being somehow forced on them. They're going to be able to look, evaluate, and I'm confident when they do that, that they'll think that this is a good thing.